𝐸𝑇 offers effective online training. Yes, it is Asia's biggest and ultimate virtual training partner with proven result. So if you want to crack 𝗬𝑇, if you want to crack IELTS, so definitely you can join our academy and you can get your desired grades or scores. I'm very happy to inform you that our academy has topped the 𝗬𝑇 success rate to 98% in 2020. So there are many reasons behind this. First of all, we are offering unlimited practice hours. Yes, so practice drills allows you to have unlimited practices directly with trainers. So these are also conducted online. So where you can have a direct interaction with the trainers. Then we are giving you 100% interactive sessions. They are 100% interactive. So if you have any doubt, if you want to discuss any module, so you can discuss at your comfort zone with your trainers. Then there are virtual learning, virtual trainings, or we can say virtual learnings. So if you're working, so you can enjoy the sessions at best comfort. So we have many students who are working, including nurses, including doctors, so they can definitely attend the virtual trainings. Then apart from this, we are also conducting unlimited mocks. So you can evaluate yourself by unlimited quizzes, mocks, and corrections. For example, if you're not feeling confident after reading, after listening, after speaking or writing, so you can evaluate yourself by participating in mock test, and you can make improvements as needed. Then we have a team of 𝗬𝑇 experts, that is, they are your mentors. So they are chosen to ensure your preparation according to the latest pattern of examination. Then the most beautiful part is that we have interactive e-capsules. Yes, they are 100% interactive, and they have videos and audios inbuilt. So if you are finding any kind of difficulty, you can just click on the link, you can just watch a video, or you can play audio. Then before 1 or 2 days of exam, we are conducting rapid revision session. So these are very helpful, and many students, they are attending it before their exam. If someone is having exam on 10th, then they can attend rapid revision on 8th or 9th. So schedules are shared in group. Then mock tests and assignments are also there. If someone is confused regarding the practice, so we are providing assignments and mock tests to ensure that they are on the right track. So they can assess themselves, students can know where they are standing, and they can know their actual level. As I already told you, that 𝗬𝑇 success rate topped to 98% in 2020, and the legacy continued for 2021. Again, we are giving you soft skill sessions also, so which help you to shine at speaking interview. And then our LMS support is 24/7. If you want to have hassle-free learning, if you want to be part of remote learning, so you have the access to e-library. Yes, so there are 300 plus lectures by our trainers, so which will help you. This is just an extra effort by DHS to help the students, and by keeping the study material at one place. Then our live shows, which are conducted every Saturday at 5 p.m. And I'm very glad to say that more than 1,000 active students participate in, and they are just complete live with all. And apart from that, they are also answering the quizzes, they are also answering the questions. Then we have community support. So your dreams matter to us. So you will be guided by a support advisor, or you can say admission advisor. So if you have any concerns, and if you want to discuss regarding the trainings, You can just call the support advisor or admission advisor, and he or she will be there to help you in every way. Okay, so now let's move to our main topic, that is our main subtest, listening. So before going to the tips and tricks as well as the mistakes, let me give you a general overview what listening is and how we should solve A, B and C part. Okay, so listening is the first subtest, that is, it is the first module on the day of your exam. So as you know, OET has 4 modules, that is listening, reading, writing and speaking. So when listening starts, sometimes what happens, some of the students, they get nervous. Why? Because there are many reasons. Firstly, in listening, audio is played only for once. You will not get audio again. So some of students, they have this thing in mind. But don't worry, if you follow tips and tricks, if you pay 100% concentration, so definitely you can score your desired grades in listening. Okay, so in listening, what happens, an audio of 40 to 45 minutes will be played, and it will be played once only. So there is no repetition of audio. In listening, the audio is played continuously. Only there are some small pauses. I'll tell you about that. And in the end, you will get 2 minutes to check your answers. So in that 2 minutes, you can just check your spellings. You can check the sequence, and you can check that whether you have attempted all the questions or not. There are 3 parts. Let's discuss about part A. So in part A, there are 24 questions. 12 questions in each extract. So in part A, what happens? You are going to hear 2 extracts, that is 2 different audios, or we can say 2 health related consultations. So 2 consultations you are going to listen. And that will be based only on the healthcare material. You will not get any general topic like it happens in IELTS or any other exam. In OET, you will only get health related topics. In part A, you will have 12 questions in each extract. So the 12 questions will be in the form of sentence completion, or you can say notes completion. So what you have to do, audio will be played and you have to write your answers side by side. Please don't write answers on another paper or anywhere else. You have to write the answer on the filling the blanks. You have to write the answer in the blanks only. So what is assesses? Part A assesses candidates' ability to identify a specific information during a consultation. Yes, Part A is easy. If you practice, you can score 24 out of 24, because here you have to fill the information by using specific words. For example, if the consultation, if you are talking to a pulmonologist and the audio is played like patient has dash cough. Okay, so here you can fill with wet, dry, whatever the speaker says, whatever the speaker speaks. Okay, and you have to use specific words only. No need to write anything from yourself. So there is no need to go into detail in A part. Just listen, fill in the correct word, and that's it. So there will be 12 questions in part A, and another questions are there in part A of extract 2. So in total, 24 questions, including extract 1 and extract 2. And the thing is that you will be required to listen to 2 recorded health professional patient consultation. And one more thing, we have to focus mainly on the patient because he is the person who is going to help us in writing the answers. Okay, the first sub-test will be 15 minutes long. So part A is going to last for around 15 minutes and already told you that it contains 24 questions. The question type is very specific and the practitioner note should be completed by using short phrases or words from voice recording. But the main thing is that it should be correct word. It should be a correct word or phrase. Don't write anything from your side. But yes, if you're not getting answer, like if your one or two answers are left, so don't waste time on that question. This is the biggest mistake which students do. For example, if they are not getting first, second, or third question, so what happens? They just try to focus on that only, and they forget about the other listening. They forget about the whole paper. So please don't do this thing. If you are not getting answer, you can just put a mark or leave it for a time because the audio will be continuous and it will not stop. So in the end, that is in the 2 minutes, you can just write anything by prediction. But please don't stick to that one question. You have to attempt rest of the 38 to 37 questions also. Before the audio is played, that is before 1 to 12 questions, there are 30 seconds before the dialogue is played. So how to use this 30 seconds? One more thing I want to tell you here, that please don't waste these 30 seconds. These are very, very important. Yes, you can do the prediction work in these 30 seconds. So you can use structure and content technique to predict. Now, what is structure technique? Structure prediction technique, it involves grammar and predicting the type of word that could fill the gap. Okay, like if it is written, Johnson is dash the water. Okay, so we cannot write drink here. Okay, we have to write drinking. We can just predict the word. We can just see that whether it is grammatically correct or not. Then content prediction. It means we can predict the word itself. For example, if it is written that she suffers from, okay, she suffers from. So we can see that here the word has to be some kind of disease or some kind of condition only. So we can again predict that here we have to fill our blanks by using word or condition, disease or condition. So we should be ready to listen these kind of words, and we have to become alert when the speaker reads out, when the speaker speaks these kind of words. Now you should know that the gaps are from within the dialogue. Yes, very important thing. Don't use any kind of word from your side. Don't use any kind of language. For example, if the speaker speaks anticholinergics, okay, please don't write anything like antihypertensive from your side. If the speaker speaks losartan, write losartan only. Don't write any kind of other drug name. So please don't write anything from your side. You have to pick words from the extract only. You have to pick words from the audio only. This is very important. Then please read the words that are written before and after the blanks in part A, because in part A you are going to get notes completion. So it is very important. The before and after words should not be same. Let me guide you on this. For example, if it is written, she has to dash it. Okay, so we can see that here we have to fill with some kind of activity. Okay, She has to dash it. For example, if the answer is pull, you have to write pull only. Please don't repeat the word it also. So please see carefully that the word before or after blank shouldn't be written again in answer. So answer will be pull only. It shouldn't be repeated again. Then imply your knowledge about synonyms and paraphrasing in this context. This will help you to recognize what the speakers are talking about. For example, instead of oral medication, they can also speak pills, or they can speak tablets. So you should have medical knowledge also. So what I would suggest you, that for every module, whether it is reading, whether it is listening, writing, or speaking, so start reading some kind of medical articles, like any common diseases you can pick. You can just have a reading of hyperthyroidism for 5 to 10 minutes. This will enhance your medical knowledge, and by this you will be able to understand the medical terminologies as well as the medical phrases more appropriately. Okay, the next thing is that you have to follow the notes closely, as the orders of the answer will be read in the same order as the question. Yes, very important. Some students, they start like, instead of starting with the first, they sometimes start with second or third. Please don't do this. The answers will be played in the sequence. The audio will be in the sequence. If first answer is written, first blanks is given, then the audio will also speak about first blank only. Notes will be more organized as sections with subheadings and headings, and always focus on the headings as well as subheadings. For example, if medical history is written, so you should know that now they are going to ask about medical history, and here we have to fill with disease or something related to medical history. If surgical history is written, so you should know that we have to write something about surgery, when it happened, or what was the surgery, that according to the audio. Okay, then the second thing is that try to focus more on how the speaker uses intonations, the tone. For example, where the pauses and signposting, where he shifts from one topic to another. So they will help you to identify if the subject of the talk has changed. For example, the doctor will take a pause before speaking about surgery. Yes, it is very common and it happens in most of the listening. So when the doctor or the health professional, he is going to speak about surgeries, so he will take some kind of pause. The most important thing in listening is that spellings. So many students still they have confusion that will I get marks if I make any kind of spelling mistake? Okay, so let me inform you here. See, in A part in listening, because it is only A part that you have to fill with spellings and all. Otherwise in B and C you will have MCQs. Okay, so if you make any kind of spelling mistake in medical terminologies, for example, if you write ACPIRIN instead of AS, that is aspirin, if you write AC, but the sound is same, okay, it is also same, aspirin only, then you will get marks. Okay, so then you will get marks. Basically, the examiner will come to know that, okay, you have understood this word. And similarly, if the answer is headache and you have written headaches, so then also you will get marks. Again, it is clear that you have at least understood the word, but the sound should be same. So like this, in listening, you can get marks in complex medical terminologies if the sound is same. Okay, so I have explained you regarding that part A and how to solve it. Now let's see part B. So in part A, we have seen that you have to fill with specific answers. So there is no need to go into detail. But in part B, there are 6 questions. Yes, so 6 questions are there in part B, and these are in the form of multiple choice. Okay, so you will get 6 MCQs. You have to shade one correct option. Remember, you have to shade. Again, this is very important thing. Please don't tick mark the answers. This also you have to do on the question paper itself. So part B, what it assesses candidates' ability to identify the gist, detail, opinion, or purpose of short extracts from the healthcare workplace. So you will be required to listen to 6 recorded extracts. Example, it can be team briefings, it can be handovers, health professional patient dialogues, and then you have to answer one MCQ. Now let me tell you about the techniques. See, there will be few questions which will test your understanding of the overall conversation and the purpose. It means if the speaker is speaking, then why? What he wants to actually say. So this is the main thing that we have to see in part B. Okay, some questions will ask for specific pieces of information, and some questions they will ask for specific pieces. Okay, so some questions they will ask you regarding the whole detail, that what is the main purpose, while the other category will focus mainly on the specific piece. But again, in part B and part C, you have to go in detail. You will not get the answers simply like part A. Okay, you will not hear the exact word also, very important. So be prepared to listen synonyms in part B and part C. You will not get the exact word most of the times. So be very conscious of all the possible synonym and the paraphrases. Paraphrasing means they just want to convey the same thing but in different way. So as a trick, okay, so there is again a trick. The conversation will hold all parts of the 3 answers. Okay, so in part B, they will also speak A option, B option, C option. So you have to listen carefully and you have to identify the best. Do not fall for recognizing words. This is a very important tip. Some students, what they do, they just see the word like part A and they just write down the answer. Please listen the full question, then write the answer. What actually they were trying to say. What actually was the speaker trying to say. Okay, now let's move to part C. So in part C, this is a little bit difficult as compared to part A as well as part B. Okay, the difficulty level increases as we move from part A to part C. What it assesses candidates' ability to follow a recorded presentation or interview on a range of accessible healthcare topics, right? So in this, either you can hear sorry, either you can hear a presentation or an interview. So in presentation, only one person will be there. That is, it will be your monologue. Okay, but in interview, there can be 2 persons. So again, this is based on a range of accessible healthcare topics. So what happens? You are required to listen to 2 different extracts. Okay, 2 different extracts are there, and these are 6 MCQs for each extract. So you are going to listen to six questions in each extract. That is 12 questions in total. And these extracts would be consisting of about 700 to 800 words. Yes, you will hear a consultation of 700 to 800 words in each extract. So these are lengthy extracts. And in part B, there will be pause after each question. But in part C, there will be continuous conversation. There will be no pause once the dialogue starts. You have to focus on parts where the speaker is moving to a new topic. Yes, when, for example, after covering question 31, when the speaker is covering, when the speaker is shifting to new topic, so you have to pay attention. Otherwise, you will not be able to catch the answer. And always pay attention how the person is speaking and the words. Words like now, well, so, etc. So they indicate that the conversation is moving towards a new subject. In the case of an interview, the questions that the interviewer is asking will indicate the topic of discussion. It means simply in listening, you have to pay 100% concentration. Please avoid any kind of distractions. Always carry a bunch of pencils so that you can easily swap. Okay, so this is a sample of part A. See, I told you that you have 30 seconds to look at the notes before the audio is played. Now, how to use these 30 seconds? See here. So here patient is Melissa Gordon. And the blanks is works as a. Okay, work. So here we can see simple present. Okay, works is written as a. So here we can understand from the blank, we can predict in 30 seconds that there has to be some kind of occupation or work, right? And here article is A. So the answer is going to start from consonant, not from vowel, because it is A here. For example, if they speak that she worked as an engineer, now she works as a teacher. So the answer will be teacher if you are confused also. Because here it is A, not an. So engineer cannot be our answer. So these small things we can predict in 30 seconds. Okay, then has a diet. Okay, what kind of diet? So here we should be always ready to listen when they speak, when speaker speaks something about the diet. Any diet, it can be vegetarian, non-vegetarian. So again, we have to be ready to listen these kind of words. Okay. Then needed. Okay, something that happened in past. Okay, some kind of treatment. Then first baby presented as. Okay, he can speak appeared also. So it means some kind of appearance we have to fill. Okay, see, just going to show you the transcript. So some background, what kind of work do you do? Here, the health professional is asking question. I have a job at an engineering company. I'm a computer programmer. So here, the answer will be computer programmer. I currently do 4 days a week, but I hope to reduce that to 3 after my maternity. Excellent. So tell me about your medical health. Do you have any conditions I should know about? Well, I have asthma attacks. So here has occasional asthma attacks. Okay, medical history. Oh, I should also let you know that I came out in terrible hives, which means some problem she is having. If I take penicillin, that is, she is allergic to penicillin. So here the answer will be penicillin. Okay. I have a fairly healthy lifestyle. So here we cannot write fairly healthy because the word after blank is diet. So please read it carefully. I am a vegetarian and I never smoked. Okay, so here the answer will be vegetarian and it is correct also according to the question. Okay, now let me show you part B sample. So 25, you hear a dietitian talking to a patient. Okay, so here who is the health professional? Dietitian, right? So here the health professional is dietitian. talking to a patient. It means something they are going to discuss about diet or some BMI, obesity. So content related to dietitian will be discussed. What is she doing? Now, what is she doing? So they are not going to tell you directly that she is doing this, she is doing that. You have to listen to the conversation and then you have to understand. For example, A, correcting the patient's misconception about obesity. It means some patient is having some kind of confusion. So she is correcting, no, this is not your fault or something like that. Then describing the link between obesity and other disease. It means she is saying that obesity is related to other disease. Stressing the need for a positive strategy. If she's saying that you have to adopt this lifestyle, you have to leave this, you have to reduce this, so then it will be C. So let's see what actually she is saying. Okay, so here is a transcript again. I feel such a failure. So this is the wording of the patient. I am sure people think that if I tried just harder, I could lose weight. Maybe I need more willpower. Well, firstly, well done for seeking medical help. Actually, being overweight or obese is a medical problem because being overweight changes how your body works. But she is not saying that it is related to other disease. So B is not the answer at all. So we can eliminate. Then what actually she is saying? Well, I hear what you say, but please understand that these days we consider that obesity is a disease like high blood pressure or asthma. You see, the body signal to the brain stop working correctly when you are overweight, and with time you feel less full even if you have the same amount. And when you cut your calories, your body tries to use energy. So basically, she is trying to she's trying to correct the patient misconception. She's saying that it's not your fault. It is also a disease like other diseases. So the answer will be A. Okay, so small sample of part C. In this, you hear a sports physiotherapist called Chris Meloni. He is giving a presentation in which he describes treating a high jumper with a knee injury. Okay, so this is a presentation. When Chris first met the patient, so this will be the continuous presentation. You will get 90 seconds to go through the questions. That is question number 31 to 36. You will get 90 seconds. When Chris first met the patient, he found that she was considering retirement from her sport. Her state of mind had aggravated the pain in her knee. She had ignored professional advice previously offered to her. So let's see what actually she was doing. But we have to focus that he found out that what he observed, what he found out. Okay, so this is a transcript again. It features a very successful high jumper in her mid-20s who was referred to me with severe pain in her right knee that the legs she takes off from when she jumps. What's more, when she stepped up her training and preparation for a big competition, the pain worsened. After that, she had taken several months of training to rest and get treatment. Okay. To her dismay, however, not only did the pain continue, it actually got worse, meaning she was unable to do any strength training, let alone jump specific work. By the time I saw her, yes, you can get your answer now. By the time I saw her, she was on the verge of giving up, having lost virtually all belief. So here we have got idea about her answer. Verge of giving up. It means she was thinking, she was planning to quit sports. So the answer can be A. She was considering retirement from her sport. So again, you must have seen that it was not a direct answer. So after consultation, they just spoke, they just read out the answer in other words. Okay, so this was about part A, part B and part C and the ways how we can solve them. Again, there are some tips and tricks which you can use to score good grades. First of all, we have to read question before listening to the audio. Already I have told you. In fact, I would like to tell you that please start reading, please start listening the instructions carefully. When the reader reads the instruction, please start focusing from that point only so that you can have your 100% concentration. Before each part, there is some time to read through the questions. Use this time to predict the keywords in the further audio. Okay, so already I have told you how you can use prediction. Then second, be familiar with the common abbreviations. Okay, so you can write BP instead of blood pressure. You can write A&E instead of accident and emergency department. So be familiar. You should know the medical abbreviations. You should know the universal accepted abbreviation. But please don't use text language. Don't write don't write UR instead of YOUR. This is just an example. So you can enhance your listening skills by listening to health podcasts or videos. And I would say you can just enhance your general listening skills also. You can watch any kind of English movie with subtitles. You can watch any kind of English video. You can listen English audio. So this will enhance your listening skills. Prediction. Okay, predict the answer by looking at words before and after the blanks. So if this is written, she has dry cough, so it means she has dry dash. It means something, condition is there. So you can always use the power of your prediction. Be prepared to listen to synonyms in the extract. Very important. Please don't expect the same word. So there can be synonyms, and nowadays in latest OET pattern, synonyms are there. Especially they are using many synonyms while reading part B and part C. Be on the lookout for a collective word. So instead of 𝗬𝗏, losartan and speaking too much medicines, the speaker can speak simply antihypertensives. Avoid spelling mistakes. I have told you that in listening, little spelling errors are acceptable. But please try to avoid them so that you can gain more confidence on the day of exam and you can perform your paper more perfectly. Okay, so this was about listening. Now I want to tell you that we are offering flexible timings. Yes, I'm glad to say that if you want to choose morning, you can. If you want to have noon batch, yes, you can. Evening batch, then also it's possible. And night batch, yes, late night people who are on late night duties, so they can attend night sessions also. And apart from this, we are having non-stop practice drills that are continuing all day long. So there are no restrictions. If you want to attend 3 sessions, you can. If you want to attend 4 sessions, then also it's up to you. There are no restrictions. So why to choose our academy? Because we are offering virtual sessions and 24/7 LMS support. Then we are offering unlimited practice hours, unlimited mock test support, and our OET success rate is up to 99%. So if you want to clear your exam, if you want to score good, definitely you can join our academy and you can contact on this number if you have any kind of query. You can be next superhero, and please go through the testimonials on the YouTube. Our achievers, they will guide you how they score good grades, how they attended regular sessions. You can be next. Yes, if you believe in yourself, if you attend regular sessions, if you put 100% efforts, of course you can be a next superhero. We have a team of mentors who will guide you and who will support you till you book your exam, till you clear your exam. Then we are offering free gifts for you. Yes. First of all, 24/7 extended support. Okay, so this is again a gift. Then unlimited trainings. Then apart from that, if you apply this, if you use this 10% coupon, so you can get 10% off. So hurry up. What are you waiting for? Okay. Thank you, dears. Have a nice day. Stay blessed.